my confidence level started dropping with every case. I have heard from colleagues that they did have challenging cases which they didn't expect to come up on the exam.
If you had to take this exam again, what would you have done differently, Srujan?
That's a good question. I think I had started sort of reflecting on this shortly after the exam, because we did discuss this in our study group. We used to practice cases by topic, by subject. I think maybe that was not probably the best way.
My guest today is a GP trainee who passed the SCA first time. Hi, Srujan. How are you doing?
Good. Thank you, Erwin. I'm glad to be here. And yeah, if this is going to be helpful, I'm glad to, help in whichever way I can.
For people who don't know you, would you like to please introduce yourself?
So I'm an ST3 trainee at the moment in the Leicestershire scheme, and I'm due to CCT in February, end of February. So this attempt of the November attempt was really the first and last kind of option that I had. So yeah, that's just the basic background about me. I am an IMG as well, so I should mention that. Prior to entering GP training, I did work in a different country, so obviously that probably is something that many can relate to, and hoping that this will help them out as well.
Share with us your preparation when you started to prepare for the exam.
So I started my preparation first for the first time in July, but I wasn't really able to continue through with that because I had, well, health reasons really that made me defer my preparation by a whole month. But it was around, I think it was in July that I reached out to you because I had looked at your website and there was lots of positive feedback about the RCA and candidates that have actually had sessions with you, finding that quite helpful. So that's really how I went about finding your website, and that was my initial first point of contact, even with the SCA prep really.
So tell us what sort of challenges did you face in your preparation, Srujan?
As you probably know, when we first had the chat back in July, I really was quite frustrated with the task of basically how to go about preparing for this exam. I wasn't really sure what to really expect because this was a new exam. We were the first cohort, or was preparing for the first cohort. So I wasn't really sure on how the exam was going to be marked. So a lot of it was really trying to understand how to orientate myself, and having that initial plan would then hopefully then allow me to create a study plan, and that would hopefully that is something I can execute through for the exam.
I still remember the chat we had where there's quite a lot of questions and anxiety because of this new exam. So then you started to plan. Then planning is really important. Tell us what did you do when you're planning for your prep?
So when we had our initial first chat and you sort of walked me through the blueprint, which I thought was very helpful because I started I remember I wrote down the 3 domains, what I need to be focusing on. And then I started sort of seeing how I can implement this in my clinical practice. And what I did essentially was, once I gathered an idea of what was expected of this exam, I was then able to find a study group. I was quite fortunate to have a very good study group, very disciplined colleagues that were all planning to take their exam in November. And so once we started discussing in our groups, we kind of used different resources. So one of the ones I found quite helpful, I started with the 100 Cases by Dr. Emily Blunt, which I think is a known book that's been used in the past for the CSA. So that was one of the things that I used in terms of preparation, in terms of the clinical side of things, but also to just learn a bit more about consultation skills. I also went through your videos, the blueprint videos, which I think you've taken up quite a bit of time, and it was quite thorough in terms of how you need to tackle each section. So one of my biggest weaknesses was the psychosocial aspect of a consultation. So I think observing you and a few other trainers out there, and there's quite a lot of YouTube resources as well with mock consultations. And I think these are really helpful because it gives you an idea of how you essentially need to consult, during a consultation, and one that's geared towards an exam setting. So that was one of the resources I found quite helpful. I found your course, as I said, that was also quite helpful. I did that in the earlier days. So that was around end of August, and that I started really putting in the work. That's really when I actually started my preparation more seriously. But I think that first mock that we did in July kind of set the base as to what it basically let me know what I needed to improve. And that's how I really sort of tailored my study materials based on that.
Sounds like you were very organized in your preparation and you're making sure that you did everything you could on your end as well. So tell us, when it came to this psychosocial, you mentioned you had some trouble with that. What were the things that you had to change?
I think one of the things I've noticed was through our that initial mock that we did, I kind of noticed that I wasn't hitting the psychosocial with every consultation, and it was a bit disorientated in that sometimes what I've realized is you don't want to sound formulaic for this exam, and I struggled with that. So I was very formulaic in my style of consulting up until then. And so that opened my eyes. That's when I started researching a bit more. I bought a book. It's called GP Consultation Skills. That was really quite helpful as well. Went into a bit more detail as to how you want to incorporate this into consultation, when you want to do it, because again, you don't want to, as many people would, some people would, they may disagree with this, but you have your ideas, concerns, and expectations, and sometimes people will just do that literally in that order. But I've found with this exam towards the end more so, I was trying to go with the flow. So it's really trying to pick up on the cues. And that was one of the biggest things I've learned for this exam through the different resources I've used.
Absolutely, yeah. It's important that someone develop their own consultation style. They are feeling that it's comfortable for them to consult under exam condition. And following the cue is really important, especially for an exam where if you miss a cue, then you can completely miss the case. So we can touch upon that in a bit. Tell us about your mindset going into the exam.
So I was quite skeptical to start with, because I knew that I wanted to attempt the November sitting, and I know that I was determined to do it, but I was equally skeptical just because of the nature of this being the first cohort sitting it and just not having enough information. But I told myself, I think once I started, got into the study group, there were two study groups that I was very actively involved with. Everyone just kind of voicing out their own concerns and their own sort of fears. It helps you relate, and then we're kind of on the same page, and we're starting from a baseline, if you will. And then it kind of helps, when we're going through frustrations, we're doing consultations, we're always getting feedback from each other, we're learning from each other. And all of that makes me think, you know what, it's not just me making mistakes. There are other colleagues out there as well that are going through the same, and just talking that through helps. So I think one of the big things I would really recommend is just having a very good study group.
Absolutely, yeah. So the people you are practicing and role playing is really important. I was just having a chat with another trainee who mentioned that there were some people who were not doing well, and it actually affects her consultation. So it's important to have a good group that can work together. How did you go about finding a group then?
So I think it really happened by chance, because I was added to an SCA group, and I think if you do keep an eye out I think if you join one group, there are people always circulating other groups in those groups. So I kind of it was a trial and error, because I was added to almost about maybe 4 or 5 groups, and these are trainees from different deaneries, and oftentimes I found that they're groups in one specific deanery. So the group that I practiced with was predominantly from our neighboring deanery, for example, and then the other one I joined was again from a deanery up north. So it was really a matter of trial and error, because I wanted to try and see, am I able to get along with the dynamic of this group, but also are they able to really help me in any way? So it's a mutual, it's really something you would have to try, and but I went through WhatsApp. There are, I think, a few Facebook groups as well, and you can even I did that as well. I actually put in a request to see if anyone was interested in practicing. So a few people were, and that's how I created my own group initially, only to find out that most of them were planning to take it in February or January, later next year. So I was just lucky really to find something on WhatsApp, and I stuck with the two groups that I found most helpful.
So yeah, it's important when you're looking out for people to practice try and get somebody who is also going to sit the exam around the same time as you are. And there is also the Facebook group, our support group, that if you're watching this, you can join it and find a study buddy from there. When you were preparing it, you also had other challenges, as you mentioned, about health problems. How did you prepare? Because it's quite busy as a GP trainee with everything you have to go over.
Yeah. So I think I was quite fortunate because I had a good network of friends. Number one, they outside of medicine, so they constantly motivated me to do better. They constantly motivated me to stick to my goal. But number two, it gets very tiring. I think you come back from work and you just have no motivation to sit down, but you just have to force yourself. And this is where I think I emphasize that a study group is so important because we had members in our group that were very much they're very serious, quite disciplined. I think that, to be honest, when I sort of reflect on that, I think that's exactly what worked for me because they pushed me to even sit. We basically set certain times in the day. So we said if I were working a full session, for example, and then I come back home, we would set a time from 9 to maybe 11 in the evening times. So we did that, and we did that throughout the weekdays, and then we would take a day off, for example, on the weekend, just to kind of unwind from everything, and then we would get back to the schedule. So it was really just sticking to a schedule. So the first thing I think is really just making sure that you write down a plan. So I did that, and this was after our initial the mock consultation, because that's what opened my eyes really as to what I needed to work on. So I wrote down a plan as to how many hours am I going to dedicate on a daily basis. And if I do miss out something, because that's bound to happen, then how am I going to make up for that? Which I did over the weekends.
So let's talk about approaching the exam now. When we're looking at the 12 clinical experience groups, how did you go about thinking of what your areas of weaknesses and focusing on what you need to prepare more?
So I think this is where there was a document that you had. It was a blueprint. It was an Excel sheet, if I'm not mistaken, where it allowed me to kind of just chart, because we did a whole day of mock cases. If you remember, Urban, I think we did that twice. This case about safeguarding. I think it was more about not just picking up on the cues, but incorporating some of those cues into management when discussing safeguarding. So one of the things I learned, for example, was how you said clearly you've been under the influence of alcohol. This is something that potentially, could lead to something much worse. So trying to use some of that information she's given, use that cue in your management. I think that was good.
Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down the description below to book a call with me to see how I can help you to pass your exam.
I remember you mentioned to chart out everything on an Excel sheet, and because you can always come back to that and you can reflect if that actually is a weakness or if that's something you do need to improve on. Or for example, if you've forgotten a case, then you can go back and you can always see, oh wait, this is what it had to do with. So when I did that initially for the first, I'd say maybe for the first month, I did that. That helped me identify that certain topics were my weaknesses. So women's health, sexual reproductive health was another one, and also certain other specialties as well. So things like urology, where I'd not remembered or forgotten the guidelines. So what I then did was, it was all about practicing the cases and learning the guidelines in context of those cases, which helped.
That's great. So when you actually were sitting the exam, tell us your own experience. How did it feel?
I thought it was very challenging. I went in pretty confident. I was quite calm, but then I think there were issues, there were technical glitches with my exam. I think to start with, I'll go back to when I actually started the exam. I was made to wait almost for a good 45 minutes to an hour. That's the time it takes for the registration process to get done. Had an extremely friendly invigilator. They do your 360-degree check, and then it pretty much went. It was quite smooth after that. It was until about the fourth consultation where there were technical glitches, so connectivity issues, not on my end, because every time there's an issue, you have to alert the invigilator, and then they'll try and sort the problem out. And they were quite good with that. But it's just that because in the process of either the camera not working or me not being able to hear the speakers, I lost a good 3 to 4 minutes in some of the consultations. To be precise, it was about 4 consultations where this happened. So they did allow me to rerun 3 of those 4, which was quite good. So I think what happened was in one of those consultations, because I'd lost a considerable amount of time, it was literally just sitting there in the station and just waiting for the station to end. So it was just one of those things.
I suppose it can be very stressful if you're going through an exam that's very high stake and having these issues. So how did you manage to cope given the stress and the pressure?
I think I utilized my break time really well. So I did get quite anxious after the sixth consultation, where I started thinking to myself, this is not going well. This is not really what I expected with all these glitches. I noticed that my confidence level started dropping with every case, because I was like, what if the connectivity goes off again? And then what? So what helped really was taking that break, practice my deep breathing, had like a snack, and then I had a bit of water. And that really, and it's just like, you're just telling yourself that, you're going to be fine. And, if there's any issues, they will sort it out, because that's what they have mentioned in the induction video from RCGP. So I think just sort of reminding myself of that helped me.
It's very important that you don't let this affect your future stations and keeping your calm and how you did it using your break. So tell us about the level of challenge.
I did think that the cases, it was a mix of cases. It was a mixed bag, really. So some were fairly straightforward. I would say things like your chronic diseases, they do expect them that you are expected to know these quite well. I think these were also tested in your AKT, and it was reiterated by program directors that you need to have your guidelines for chronic diseases really in the back of your mind. There were some that were very, they had twists. I think almost every case had some form of a twist. So either that would be in history taking, or that would be in the psychosocial aspect of things, or the patient's expectation. So it's really trying to stay calm, and because it can rile you up. Because the reason I say this is because when you're practicing with groups and you do mock consultations, you often have a structure in your mind, and you're able to go through that. You're able to prepare for it because there's a presenting complaint, or you see the topic on the top of the consultation, that nocturnal enuresis, for example, and you're already formulating your questions. But in the exam, you don't know what's going to come up. So the only way to manage that uncertainty, I suppose, is to just go back to your basics. In every single case prior to the case, you get a bit of prep time. I think it's really essential to utilize that well. So I would write down I had my basic structure of points that I had to cover. And I would, if there was any cases, for example, from a clinical standpoint, that I was a bit unsure of, or I had differentials, I would just write those key points on my whiteboard, and I would make sure that I would address those in my history taking and my management.
You seem to have a structure and you're using the whiteboard effectively, which is really good. So tell us then, when it came to the stations that you had the most trouble with. For example, sometimes trainees might feel like they don't know anything about the case. What were the things that you did?
Yeah, so I had two particular cases where I felt this way. I literally did not. I think most of us were always stuck in this mindset of finding out the diagnosis first. And then I think we take that too far, because then you lose almost 6, 7 minutes and you're still asking questions. And then when you have to realize that this is all about risk management and risk assessment, and being able to identify that, and being a safe practitioner. So I think um, this is something. So even though I kind of focused on the risk and the management and that aspect of things towards the end of my prep, when the real exam stares you in the face, you're still back to your diagnosis. Like, what could it be? Because so what I did was, essentially, I asked my basic question. Then you would have to just go back to your basics, try and ask about how this, just the characteristics of the pain itself, go from broad to specific. And then the main thing is really let the patient lead you, because they're always giving you cues, and the cues being given for a reason. And I found in those two cases I had, the patient, they'd given me the cues almost, I think, maybe twice in both cases. And then I went like, oh wait, there must be a reason why she's mentioning this very early on into the consult. So I think what it does, it derails you, because in your mind you have a structure, but then the patient also has a script that they're reading from, and how they choose to sort of respond to your questions, and when they choose to put in their ideas, will come off completely unannounced. So you need to really just you need to develop a flow. I would say don't stick to have a structure, but be very flexible around that structure.
The structure is there, but don't be rigid about the structure. You need to be able to adapt your consultation based on the situation. So the thing is, with this type of exam, I think a big part of it is the preparation and doing the work beforehand. Because as you said, during the exam, then you might revert back to your old practice and habits. So if you had to take this exam again, what would you have done differently, Srujan?
That's a good question. I think I had started sort of reflecting on this shortly after the exam because we did discuss this in our study group. I think one of the things I would have done was initially in our study groups, we used to practice cases by topic, by subject. And I think maybe that was not probably the best way to approach the exam. I think it's better to do a random selection of cases and then read the guidelines around that. So I think I would have approached that a bit differently. I would have probably, what happens, I think, when you do when you follow that approach is that you become more lateral in your thinking. So you know that this is not something you're expecting, it's coming out of the ordinary. So you just need to, you tend to, when you're, I think, faced with that situation more and more frequently, you become more comfortable over time. So that's one of the things I would have done differently. And other things I probably would have done is maybe gone back to some of the NICE guidelines, which I thought for some of the cases that I thought wouldn't really come up. I have heard from colleagues that they did have challenging cases which they didn't expect to come up on the exam. So I would just say don't underestimate the knowledge that's needed, because I think as our program directors mentioned, they said they are assuming that you have your AKT, your NICE, that you have the knowledge aspect of things, and you're just putting that into practice, but in a refining your consultation skills essentially. So it's a stepwise process. I think start with the knowledge aspect of things, look at the clinical style of consulting. I've noticed that initially I was practicing one thing in my groups, but then I went back to the surgery the next day and I'm still doing my old patterns of consulting. I'm like, I'm not really seeing any changes now. It was only, I would say, probably from about mid-September where I started really thinking, okay, I'm actually started seeing the changes as well in the way I'm consulting, because I'm actively implementing that stuff. Because I used to make little notes saying, hammer the ice even in your day-to-day consults. So I think having that, as I said, I think it goes back to really the prep strategy. If you have that in place, everything falls. It's just really executing that to the end.
So it's one thing reading about the guidance and learning it, and then it's another thing to be able to apply it and consult so that it all falls into place when you do it. So if you had to speak to somebody who's really struggling, has not passed the exam, what would you say to that person, Srujan?
So I think what I would say is, with regard to the exam anxiety, I think treat the exam like a routine day of your surgery. This has been reiterated to us in different forms, either through your course, or it was even through the program directors. It was always emphasized on. And then the next thing is you need to have a solid battle plan to tackle this exam, and once you have it, execute it. There's no ands, ifs, and or buts. If you find that you're not able to put in the work during the week, make up for it over the weekend, but you need to be consistent. And how long you need to be consistent for is very much independent on you as a trainee, really. So I think for me, I put in all the work really September, October. So that was the most sort of the core time when I spent in the most amount of preparation. The other thing is, don't just view it as an exam. Try and learn this for your career, to try and be a better GP. Some of the things I've learned from my exam, I'm still incorporating to this day, and I find that my consultation skills have actually become they have improved tremendously. And just revisiting all the guidelines, all of that really adds. It just adds to your whole professional career, I think. And the last thing I think is, even though you feel that you may not be able to implement the stuff that you're learning in your study groups, over time, you'll find that you're naturally implementing this in your day-to-day clinical practice. So it almost becomes like, I don't know how that happens, but it just transfers onto your clinical. So I found, obviously, you do need to actively practice it, but I found that it just started happening around mid-September for me.
That's really good, that everything went well. Even though the exam, there were some glitches, you managed to carry on and succeeded. Thank you very much for sharing your insights with us, Srujan. What's next for you then?
The next steps would be to just finish training now. So that would be end of Feb, hopefully, pending the ARCP outcome. And then just really job search and going about the next few steps. So that's a whole another topic for another day. But there's anxiety associated with that. So I'm just taking it one step at a time. And thank you so much for your help, Erwin. I think the course was really, really a good course. It was one of the few ones that I kind of found quite well. I only did that one course and I was an observer for another one. But I think just having that individualized feedback really helped.
Great. Well, I'm glad that this helped you. And in the future, if you've got any question or anything, please just send me an email. And if you've got any friends or anybody who's struggling with the exam, you can let them know about the program.
I have, yeah. I've informed a few already, so they may be looking to join your course for February or March, I think, yeah.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.